What is going on, gangers? Brother Namdi back at your service, and I'm here to dive into a continuing series where we look at fictional characters and what health conditions they may have. If you'd like to stay caught up with this series, please make sure you subscribe to my channel. For part 36 of this series, we are going to dive into a fictional character that people may or may not know, and his name is Inumaki from JJK. I decided to use pharyngitis to describe Inumaki's condition. Let's first dive into what pharyngitis actually is. So pharyngitis is inflammation of the pharynx, which is the back of the throat. It commonly causes a sore throat and is one of the most frequent reasons why people feel throat pain. Causes of pharyngitis would be viral infections that include common cold, flu, COVID, or mono. Another cause would be bacterial infections, most notably group A streptococcus, which is commonly known for strep throat. Irritants like smoke, pollution, dry air, allergies, or even GERD, which is also acid reflux. And I guess you can even say overuse of the voice. Types of pharyngitis would be acute pharyngitis, which is short-term, usually viral, or chronic pharyngitis, which would be long-lasting, often due to smoking, allergies, or acid reflux. Symptoms to look out for would be sore or scratchy throat, pain when swallowing, red or swollen throat, swollen lymph nodes in the neck, hoarseness or voice changes, fever if it's bacterial, and or white patches on the tonsils. Now, based on the previous things I just said, Inumaki correlates well with this. Inumaki's cursed speech forces his voice to carry cursed energy. Every time he speaks normally or uses commands, it places extreme strain on his throat. And this is similar to someone overusing their voice, causing inflammatory throat conditions like pharyngitis. After powerful commands, Inumaki is often shown coughing, holding his throat, spitting blood, speaking less, and that's due to inflammation in his throat now. And that directly correlates to recurring pharyngitis, where the throat becomes inflamed and painful after irritation. And lastly, Inumaki restricts his vocabulary to prevent damage, much like someone with chronic pharyngitis would, just so they can avoid excessive speaking, resting the voice, and preventing flare-ups of inflammation. With all that being said, how can we diagnose pharyngitis? This would actually be simple. A physical throat exam may be done by the provider, a rapid strep test or throat culture if bacterial infection is suspected. And for treatment, it would depend on the type of pharyngitis, guys. If it is viral pharyngitis, we would recommend the patient to rest, take fluids, pain relievers, or throat lozenges. If it is bacterial, we would recommend antibiotics. But for both cases, we would say avoid irritants and stay hydrated. Pharyngitis is usually mild, but if symptoms are severe and duration is long, medical care is important because untreated strep throat can lead to cardiac problems, guys. But as you guys know, Inumaki is seen to use medication to soothe his throat, almost looking like a throat syrup. But I digress. As always, if you have any of these conditions, please seek help, because at the end of the day, you matter. Fictional characters were used to give a different perspective in a situation. If you appreciate this video, please like, comment, and subscribe. If you haven't already, please check out the previous 35 parts to this series. If you have a suggestion for part 37, drop it in the comments. And if nothing else, y'all take it easy.